Hello, I'm Dave with Rook Products. Happy to be here today with you virtually. At Rook Products, we manufacture 4 devices. We manufacture a Rook vascular boot, Rook vascular mitt, a BKA below the knee stump protector, and an AK above the knee stump protector. So I'm going to detail all 4 of those for you very briefly. Our Rook boot, last year we made a little bit of an enhancement to it, and we made a deeper, more gradual slope for the heel cup. What that does is that's going to offload your patient, excellent offloading for the patient. Material is synthetic, so there's no allergy issues, but what it does is it naturally warms to help vasodilate your patient. When they've had the boot on for around 60 minutes, it's shown to have an increase of 5.3 millimeters of mercury in TCPO2s. Where one size fits most, can't say all anymore, people are just getting too big. And opening up the toe box area, we can take up to a size 16 foot, adjusting this up and down, all the way to a transmed amputee. So what I would suggest is when you lay the limb in, put this around the leg area first, because if you have a patient with a real small foot, we don't want this tongue to be underneath there, which could cause a pressure point. We'll bring this up to whatever length the foot is, pull that around there. Now we do have slits on both sides in the front for your SCD lines, vac tubes. We've also added a slit up here so that you can snake out those tubes, bring them out that area, and maybe eliminate creating a pressure point. Grippy surface on the bottom. While we don't recommend the patients walk in the boots, however, we realize that they do from time to time without assistance, less likely that they'll slip and fall. Foot drop straps. You put your patient's limb in, whatever angle they need to keep it at, just give it some gentle retraction and tack it onto the side. We're not going to make that situation any better, but it's not going to get any worse. And if they don't have an issue with foot drop, you can take them down about 1 inch on each side, and that way it gives them a nice range of motion in their ankle. Also, which comes with each one of the boots, is an anti-rotation wedge. You'll notice there's Velcro on both sides of the boot. Whichever way the limb's rotating, you want to prevent that. Just take the Velcro, tack it on, and it'll prevent the rotation of the limb. Now the boots are washable in cold water temperature, so you don't want to send them to the hospital laundry, because if they do find their way back, the hot water temperatures will kind of melt the inside. So you can clean them up with soapy water alcohol. If you have a weepy wound, cut a breathable chuck, place it inside. That'll help absorb that and keep it a little bit cleaner. Now to the Rook vascular mitt. It opens up in the middle. It's a design change we made about 2 years ago. That way, if you have an unresponsive patient, it's easier to get their hand in and get this sealed over on that unresponsive patient. Also, it's easier to check your gas lines, arterial lines, blood gas lines. I mean, you don't have to take the patient's hand out of it. You can open this up. Strap is for those patients with small, wispy limbs, wrists. That way you can pull that over a little bit. It'll prevent it from sliding off. The material is the same as the boot, so it's going to perfuse your patient quite nicely. So if your patient has Raynaud's, AV access steel, any type of hand ischemia, or even a digital reattachment, this is great for those patients. And if your if your hospital is doing a VA ECMO, consider putting Rook boots and Rook mitts on those patients. We'll perfuse them quite nicely, and the new enhanced offloading of the Rook boot will help protect the Achilles of the patient. So if you're interested in getting a pair for trial, we can send you a pair of boots and mitts and get that going and see how that works for you. So just shoot me an email, which my information will be on the end of the video. Third product that we have is our Rook below the knee stump protector. We're going to be able to customize this to your patient's limb length and width. Same material as the boots, so it's going to also perfuse your patient and help in the healing process. So when we lay the limb in, right now we're going to do the customization of the length. We want the end of the residual limb resting comfortably here. The patella should be right in between these flaps, because the device is for immediate post-op use, contracture control, and fall protection. We have actually had 29 reported patients wearing this, falling, and not one is dehisced or converted to an AK. We're really proud of that fact. The end cap is very well padded and protected for your patient. So if the patella is right here and the end of the residual limb is not resting comfortably, we put in 2 spacers to help build that up to keep the patella here. That's how we're going to obtain the contracture control, by having the patella right here in the patella window. Now, if you put in a pad and it moves the patella a little bit too far up, this end cap, excuse me, has 3 strips of Velcro. It can be taken down so that you can actually customize this, your patient's limb length, keep the patella right there. So to customize it for the limb width, these flaps, both of them have double stitch lines. We put in a pair of scissors for you, so you can cut them, not fold it like I'm doing for the demonstration, but cut in between the double stitch lines to fit your patient's limb width. If you cut in between the double stitch lines, less likely that the material will fray. So we'll do that on both ends. And this is the pad that's going to go over the top of the patella. That's how we get the contracture control. So with we put a gentle sticker on this, because with a lot of contracture control devices, you have to crank them down to get them to work properly. With this, you don't. What you want to do is you want to put it right about on top of the patella, bring it down about a 1/2 inch, secure it to each side with the thick Velcro strips. They're not going to be able to pull this up or kick it up, but when they have that pain response, it gives them a little bit of wiggle room, and it'll push them back into place. How does it do that? There's a hard backing that runs the length of the device. So it kind of gives them a little bit of range of motion there, and then pushes them back into place. Now, if you run into a patient that has a really large thigh, we do put an extender in. Velcros onto the pieces here, so you can customize it and get a little bit bigger for that large thigh. Also, on the belt buckles, we have put a lot of excess on it so that you can accommodate almost any size patient. You can cut this if you don't need it, or you can fold it down and tape it around. But you buckle them up. The thing that we put in with each one of the devices is a waist belt. What this is used for is when your patient goes to physical therapy, you'll take the waist belt, put it around. Notice there's a lot of excess, so it's going to fit that very large patient also. This is the strap that's going to connect to the device. It's universal, so it goes to either side, slide around. So whichever side you have the device on, you'll take this, tack it onto the side, and it'll keep the device up while they're in physical therapy. So make sure when you see this, put this on your patient, you take the Sharpie, write their name on it, so it goes along with them, so when they do get opportunity to go to physical therapy, it's there with them. Now lastly, we have an AK device. The AK we came out with last year. Very similar to the BK. We open it up, very well padded on the end for immediate post-op use and limb protection. Once you lay the limb in, if you have a short limb and you need to pull it, put the spacer in to help build it up a little bit, we put a spacer in. The end cap also is adjustable, so you can customize it to your patient's limb length. Fold this over, and as on the BK, we have double stitch lines in this flap. We put a pair of scissors in for you, so you can customize it to your patient's limb width. Now, how do we hold this up? Well, we have three belts that we put in. First one is a waist belt, and you'll notice very generous in its sizing. You pull it up on top of the pannus. Soft material, so this can be worn in bed, and we recommend that once it's on, stays on the patient in bed. Limb attachment strap. You want to take the Velcro facing outward, pull it underneath, and it will Velcro right to itself. There's 2 of them. Put them both on. Velcro on both of them outwardly. And then they will attach to the device. The way it's attached to it, you can bring it up ever so slightly or lower it ever so much, because with the conical shape of the limb, it's really hard to keep this steady and not riding up too high in the crotch. So that's why we have both of them on here. You can adjust it, keep a nice firm spot on the device on the patient. So I'm going to put up here my contact information. If you have any questions, comments, would like a sample of any of our products, please reach out to me. Thank you very much for your time and have a great day.